Good afternoon. We are Team 23, Grady's Anatomy. Our faculty advisor is Dr. Ayer Turgay, and our client is Grady Memorial Hospital. Our client contact is Ayanna Koppman from Grady and Dr. Stacy Schmidt from Emory. Our teammates are Jae-hee Lili, Laura Thompson, Surya Kella, Tara Varadarajan, Jessica Sang, and Elena Chen. For our senior design project, we worked with the primary care clinics at Grady Memorial Hospital. As a teaching hospital, the projects we focus on have certain process requirements involving the staff in training and their supervisors. The motivation for this project is to reduce the percentage of patients spending more than 120 minutes end-to-end in the clinic.
Moving forward, we will go over the current process flow to help us identify the areas of opportunity for the client. The cycle time starts when the patient arrives and checks in at the front desk. As the patients are sitting down in the waiting room after the check-in process, the clinical staff walks them to triage, where the clinical staff conducts basic checks such as blood pressure, height, and weight. Afterwards, the patient is led by the clinical staff to an exam room, and the patient will wait for their provider, in this case, a resident. After the resident completes the initial exam, the resident goes to find an attending. As part of the learning process, residents, who are physicians in training, must engage in a resident-attending conversation with their supervising attending. After this conversation, both the resident and attending return to the exam room to finalize the patient visit. After both the resident and attending leave the exam room, the patient is once again accompanied by the clinical staff to the checkout and leaves.
I will now go over the recommendations and deliverables we had for Grady Memorial Hospital. When examining the opportunities around Grady's future hiring strategy, we tested 10 different hiring scenarios and found that the most beneficial was to hire one resident and one clinical staff. When incorporating these additional staff numbers, we saw a cycle time in exam room savings of up to 3.2 minutes per patient, which can lead up to 4 additional patients being seen per day. For appointment type scheduling, we used visit type categories calculated from our observations at Grady to determine the best order of scheduling visit types. Through simulation, we found that ordering patient appointment types in a way such that different residents are scheduled for different appointment types at the same time had the best results. By ordering appointments this way, we reduced the number of residents who will be looking for an attending at the same time, which, according to our analysis, will lead to an average cycle time decrease of 5.7% per patient. Within this clinic scheduling opportunity, we also tested the impact of switching from a single lunch break to a staggered lunch break, where we split the total staff count in half to take breaks in 2 time blocks without completely shutting down the clinic. As a result of this staggered lunch break model, we found that there will be an increase in throughput by 9% daily, which translates to 1 additional patient being seen per resident per day. When analyzing the common miscommunications between staff, we found that in 27% of appointments, the resident was unable to immediately find an available attending after completing their initial patient exam. On average, it took 5 minutes for the resident to find an available attending to speak with. To reduce this, we proposed a real-time attending status dashboard, which will display each of the attendings that are working that day, the current availability of that attending, and the time remaining until they will be available once again, which should allow residents to locate an available attending quicker and utilize the time in which no attendings are available more effectively.
Welcome back. By allowing Grady to see more patients in the primary care centers and provide more opportunities for preventative care, we can reduce the number of patients requiring a visit to the emergency department later on. And this should contribute to the overall health of the community as a whole.